Yes, there you are. Show meeting, hide meeting. Yeah, is the audio. How is the audio? Here, Kirti Parmar. Unmute, Kirti. Unmute. Yeah, there we are. Yeah. All right. Yeah, you can start now.
Good afternoon, Mr. Lincoln.
Good afternoon, nurse.
My name is Kirti Parmar, and I am one of the registered nurses working in this medical clinic. If you don't mind, could you please confirm me what is the reason for your today's appointment?
Yeah, nurse, I'm very much pleased to inform you regarding my problem. But the thing is, yeah, I'm 60 years old and I'm diabetic. And I have been using these injections for these medications for the last 2.5 years. And now the doctor told me to change it to insulin injections. That's the reason why I am here. Can you please tell me, nurse? I have been managing well with my diabetes diet, medication regimen, and exercise program, but still the doctor wants to change. Can you tell me what is the main reason for this?
Thank you for confirm this reason for your appointment, Mr. Lincoln. And don't worry, right now you are in a right place, and I would like to give you each and every information regarding your insulin administration. So, first of all, I would like to know that how are you feel about the insulin injection?
Yeah, I am little bit worried. I'm anxious. I'm unsure about starting insulin injections. I have been managing my diabetes well until now, and but still this is happening. Why? What's the? How can I avoid this one? I'm little upset.
I can completely understand your situation, what you be going through now, but try to not worry with the better instruction regarding the administration of the insulin injection. You feel better now. And I would like to give you all the instruction regarding how to manage your diabetes level with the use of the insulin injection. So, before moving ahead, could you please tell me what is the main reason? Are you anxious about the insulin injection?
Yeah, actually the thing is, I don't really like the thought of injecting myself. I don't think I'll be able to do it.
I can completely understand. As I were in your situation, I would react the same. But I can reassure you that about injection, with the clear instruction and practice, it would be very easier to managing the administer of insulin injection. Are you getting my point, Mr. Lincoln?
Yes, of course, nurse.
Okay, and it is a very important of the insulin injection because the insulin injection directly go through your bloodstream, and it is a faster absorption as compared to the oral medication and diet. Are you getting my point?
Yes, of course, nurse.
Okay, so do you have any further more concern or questions,
Yeah, I
Mr.
want to
Lincoln?
know if there is, okay, you already told that this is the best possible option. So you might have
Mhm.
tried all the options. Now I understand. The information is very clear. Now tell me about the procedure, nurse. What should I do? What is it all about? And how do I get these injections? I'm scared because I never took it in my childhood also.
Your concern is totally reasonable, Mr. Lincoln. I would like to explain you what is the procedure, how to administer the injection. So, first of all, it is a necessary to washing your hand and then after drying your hands, and then pinching the skin and take the insulin needles and insertion of the needle into the 45 to 90-degree angle, and after administering the injection, leaving in the place at least 5 to 10 seconds. Are you getting my point, Mr.
Yes,
Lincoln?
yes, of course, nurse.
Okay. And now I would like to describe you. It is a very necessary to rotate the injection site because it would be very helpful to preventing the formation of lumps and some risk of the insulin absorption. I hope I am not confusing you, Mr. Lincoln.
Yeah, that's very clear, nurse. Absolutely fine.
I appreciate you are clear now about insulin injection, how to administer it.
Yeah, now you tell me about the various sites I have to take the injection. Then how do I use the same site, or shall I change the sites every day? And what about the injection, syringe, and needle? Should I use disposable needles, or I can use regular needles? What all the things I need to know, nurse?
That's a very good question, Mr. Lincoln. You every day you should change your site of the injection, and you should administer the injection at the upper arm of your upper arm of your muscles, and it is a very important to safe needle disposal. Before going home, I would like to give you the suitable puncture-proof container. And after using the insulin needle, it is necessary to dispose the needle in this container. Are you getting my point,
Ye-
Mr. Lincoln?
yes, of course, nurse.
Okay, and keep in your mind after opening the insulin injection, it is a very necessary to store in the refrigerator and not exposing to the sunlight and high temperature. And it is important to checking the expiry date of the insulin injection. Now, I hope I am clear all your doubts regarding the insulin disposable, how to administer the injection. Are you understand what I say, Mr. Lincoln?
Yes, of course, nurse. That's very clear. I feel better about the injections now. And what if the container is filled? What should I do next?
Your concern is totally reasonable, Mr. Lincoln. If the container is full, so I will give you the before going home, I will give you the leaflet pertaining a contact number, and if you feel your container is full, so you can contact this number. Our hospital nurse will come at your home and give you the new container. I hope I am clear everything about this procedure.
Yeah, nurse, everything is clear. Thank you very much. You have given good idea regarding this. Thank you once again.
Okay, so now I hope are you willing to observe this self-injecting injection?
Yeah, of course, nurse. I give my
Oh,
permission. You can watch. I'm ready for you to watch me giving myself an injection. And if there is anything wrong, you can guide me and suggest me appropriately according
yes,
to the
yes,
situation. Thank you once again,
yes,
nurse.
of course. Okay, thank you so much for your cooperation and patience, Mr. Lincoln.
Yeah. So now let me give you the feedback. Yeah. So right. You can mute your phone. Yeah. So Kirti Parmar. Right. So I'm going to give you feedback. Listen patiently. What all the things are there related to your speaking session? Yeah. Kirti Parmar, this is the first speaking session online with me. You are very bold enough. You are ready to come online and you are ready to speak. That's really, it shows your guts and your confidence level. And I have noticed that one through your speaking session also. First thing, yeah, your confidence level is extremely high. I'm proud of it. I'm proud of you, and your confidence level is really, I appreciate it very much. It's very high, rarely seen in many people. Now, sound knowledge of the subject, insulin injections. I think you have good idea about it, and then the way how you have prepared also tells, because If you have early knowledge regarding these insulin injections, then only you can speak so confident. Just today you read and you speak. No, you should have some subject knowledge about this. So that shows that you have tremendous knowledge in the topic or subject that is called insulin injections. Yeah, what all you preparation added to that earlier existing knowledge. Then fluency. Yeah, you are very fluent. Not many places you had pauses and breaks. Very confidently you are speaking, and you are not using that like that one, and you are not having too many breaks or pauses in the sentences. You're doing very fine. That's no problem at all. Accuracy. Yeah, there are some situations where you missed some accuracy, grammatical accuracy, I mean. Are you understand? You said, are you understand? That's a mistake. It's a do you understand? Do you understand? Or are you able to understand? Or is that clear? But are you understand is wrong. When you say are, there should be ing. Are you playing? Are you singing? Are you sleeping? Are you dancing? Are you understanding? Like that. So, do you understand? That's correct. And you said, come at your home. The nurse will come at your home. The nurse will come to your home. So these are some inadequacies or mistakes. Okay, some, very few. I do not count everything. You can listen to the audio afterwards. I'll give you the printout also. Okay, I'll give you the script also afterwards. Don't worry. So a nurse will come to your home. A nurse will come to your home. So that's what it is. Not come at your home, come to your home. Okay, she will meet you at your home. She will meet you at your home, meeting at your home, but coming to your home. Meeting at that place, but coming to that place, not at that place, coming to that place. Meeting at that place. So remember, she will meet you at your house, but she will come to your house. So you should know what type of um, words you are using here. Okay, yeah. The next one, the words at or to. Which word you have to use? You should know very clearly. That's very important. The next, grammar. Fine. A lot of variation is there. Some minor here and there mistakes are there. There's no problem. Vocabulary. Yeah, it's average range vocabulary. You can improve your vocabulary. There's a lot of place to improve your vocabulary. That's what I'll tell you. Next one, pronunciation. Yeah, everything is clear. We cannot speak like native speakers, but our English is able to be understood. It's clear. Okay, it's clearly understood. So no problem at all. The next one, repetition. Avoid repetition. Avoid repetition. There are some sentences you are repeating. One time you use an expression, don't repeat that expression. For example, if you say, do you understand in the beginning, then again don't use do you understand. You say, is that clear? Do you have any doubts? Like the different versions you can use. Okay, so don't repeat the same thing. Then next one is Mr. Lincoln, Mr. Lincoln, Mr. Lincoln. Too many times you are using, maybe 5 or 6 or maybe more than that you have used. Okay, so why are you using so many times Mr. Lincoln? Why? Do you think I don't know my name? Or do you think I forgot my name? Or do you think that you are reminding me my name? But exactly is that. You and I, only two persons are there. There is no need of repeating my name time and again. That's the point. Very clear. So what is the need for repeating my name? Remember that. Don't repeat unless and until it is warranted, necessary, relevant, and important. So this is the feedback. Yeah, you have done well. This will score you something like 370. Okay. Right. 380 also, right? It's range that the confidence level has given me a privilege to score you near 370, 380 range. Okay, but definitely not 390. So 360, 370, that's fine. You're doing well, no problem. So you can improve the quality like how? Now let me give you an idea. I understand your concern, which is reasonable. There is no doubt. This is the way how majority of the individuals react when they are told about self-injecting insulin in the first place. It's normal. Anyone will do like that. So there is no need to worry. If I were in your place, then I would have also reacted in the same way. So what's the deal here? Right. Relax. The doctor is the authorized person to decide, recommend the course of action required of you. After considering every possible option, only then the doctor has recommended insulin injections. You can trust him. He knows better. See how many different types of sentences you can speak. Anything you can speak. Speaking is important, non-stop. Therefore, relax. You're in safe hands. I'm going to explain everything to you. In case you still have any doubts, afterwards you can discuss with the doctor. As of now, I'm going to pinpoint each and every aspect. I'll be with you until you gain confidence. Be it for 1 or 2 days or maximum 4 or 5 days. I'll be there until you're confident. Otherwise, you can come here until you learn it properly. There is nothing to panic. Stay calm and relaxed. The only difference is you're taking insulin injections. Other than that, everything is normal. You lead a normal life. As of the condition, as of your current condition, the blood glucose levels cannot be managed with medication and diet. It has crossed beyond the limits. And now this is a stage where no other option can be considered. That is the reason why the doctor recommended you insulin injections. See, this much I spoke. Maybe 4 or 5 minutes only this thing. You can take at least 1 point, 2 points, 3 points, anything like that. If you know the subject, then you can definitely speak. Okay. So this I'll give every session with everyone. I'll give new topics. For you, I gave this feedback and 1 or 2 sentences. For another person, I'll give another one. So like the different people, different. So every speaking you listen, which I put in the group, WhatsApp group or Telegram group or YouTube channel, then what you have to do is try to listen the full video. So how the examiner is asking and how the candidate is speaking. And then listen to all my feedback. Okay, what is right, what is wrong, how to improve, what is improved, what is not improved, which area you have to focus. All these things I'll tell. Afterwards, I'll give some recommendations, special sentences like how I am giving you. These you can use in writing or speaking. So that doesn't matter. The styles you can use everywhere. Okay, so don't miss any speaking session, whether it is nurses or doctors in the group. All you attend, because every ending has my suggestions, recommendations, which can improve your quality, which can be used in every test. The same sentence which I told you, I'll use in some other COPD. There is nothing to worry. Your husband is only one of the many people who is facing this medical condition, chronic obstructive pulmonary disease. I agree with your concerns. It's very difficult to manage full time. Same thing. I'm changing here for this one, adapting this one. So need not worry. If you cannot manage, there are very other options. You are working as a full time employee, manager in an organization now. Earlier you resigned and you are taking care 100%, 24 by 7, care of your husband. But now you have to manage many other things. You have to buy rent, you have to buy food, medications, manage the house, parents, provide care and facility for your husband, also treatment. Everything is on your shoulders now. I can feel, I can sense the pain, but there is no other option, right? So what we can do, best option, either you take up over again as a full-time carer, that which you cannot do. Therefore, the other option, the only important option left, sorry, we have two options. One is you can employ a nurse for the time period you are not at home, so that they will take care of him. That's one option, but that's not the best. This may be better, but the best option is to transfer him or admit him in a care home where there will be 24 by 7 attention, focus, and concentration. Somebody or the other, nurse or a ward member or an assistant or somebody, will be always watching her and at the service. I prefer you that. So you can meet him and you can do all the other things and you can focus on your work. You need not worry about anything, what's going on back home. So you'll be in safe hands, they'll take all the responsibilities. After considering every possibility, I'm suggesting you this one. So the same thing can be applied in any other speaking session, anywhere. Burns, burns. Your son is in pain and agony and he's crying. I can understand. As a mother, you're in pain. The pain is unbearable. You cannot see your son crying. If I were in your position, and if my child was suffering in the same way, I would also have reacted in the same way. No doubt about that. But the doctor is going to take care of him now. I'm not the authorized person to diagnose or do anything now. The doctor, just wait for 5 more minutes. He's in safe now. If it is an emergency, I'll immediately transfer. But just wait. The doctor will come and he will, first thing is, he will see your son. He will diagnose the problem and the intensity of the pain and treat your son accordingly. Your panic, your worry, your agony will not reduce the pain he is suffering. Therefore, stay calm. If you are in panic, then who is going to support your son? You have to make him relax. He is in pain. Try to comfort him. Try to soothe him and calm him. Okay, instead of that one, you cry and you are in agony and you are shouting. There's nothing going to be happening. Nothing is going to happen. So just relax. Shoulder the responsibility. Tell some soothing and comfortable words to your son, and the doctor is on the way. And so everything you can adapt, one sentence, two sentences, any sentence to any particular. Just relax. Okay. After diagnosing the patient, if the injuries are very serious, third degree burns or second degree burns, he will be admitted in the hospital. If it is just first degree, then maybe some treatment will be given and he will be discharged back home or whatever. So, according to the situation, you will automatically construct and develop the points. Yeah. So that's where is this girl? Kirti Parmar. Unmute. Hello, Kirti. Unmute and start your video. Are you there, Kirti? Hello? Hello?
Yes, yes, sir.
Yeah, start your video. Yes, now you share your points. What did you feel about the feedback? How was that? Yeah, so share your experience.
Yes,
Yes,
sir.
please.
Uh, Sir, next time I don't repeat all these mistakes that you have already told me.
So, how did you feel
And
about the session? How was the session? Was it useful for you? Did you overcome your fear? Are you gaining confidence? Is it happy or sad
yes,
moment for
sir.
you? What is the
Very happy.
benefit you are getting? Tell na 1 minute, 2 minutes. You have time to speak so that I will understand. If you say this is useless for me, so I will not do these sessions. We'll do something else. If you say this is beneficial for me, we'll do more sessions. I'll give you so that you'll from A grade to B grade, B grade to C. C grade to B grade, B grade to B plus, B plus to A grade. We can try more if you are so like that. Speak. Open your heart and speak. Na?
Yes, sir. Yeah,
Yeah.
it's a very beneficial for me because in this session I will build up to my confidence level, and there are many things that I learn in this session,
Okay. Right.
like how
Hmm.
to communicate with and don't repeat the name of the interlocutor, and don't repeat the sentences.
Yeah. That's good. So you can stop your audio and you can stop your video. Yeah. So next, Kirti Parmar, Robel Rahman. Hello, Robel. Hello, Robel. Dr. Robel, unmute.
Hello, sir. Good morning, sir.
Good morning, sweetheart. How are you?
I'm fine. Are you?
I am awesome, wonderful. That's really great. Yeah. So I'm very happy to see you here. So now what we can do is you can do one speaking session if you are comfortable because okay, long time we did not have speaking session. So you can tell me which card you want to do. You tell me. Okay, so that I will send that PDF. Okay, I will send you the PDF. I have sent you already, I think. Robel. Yeah, first let me stop this.